Tuberculosis. Tuberculosis is caused by the pathogen Mycobacterium tuberculosis and Mycobacterium bovis. Mycobacterium tuberculosis is for humans and Mycobacterium bovis is for cows. Or this bacteria may remain inactive for many years and do not show any symptoms. They may become active after some time due to weak immune system, malnutrition, or HIV infection. If the bacteria is active, a person experiences persistent cough, lose weight, and emaciation. Emaciation means abnormally thin or weak feeling of a person, and their appearance is as such as well, similar to this one. Methods of transmission would be through airborne droplet or via undercooked meat and unpasteurized milk from cows. It is found worldwide, and the incubation period may be from few weeks or up to several years, depending on how strong the immune system of a person is. Site of action or infection of the pathogen would be in the lungs first, but if it's not treated or a person was not diagnosed with tuberculosis, it could have secondary infections found in the lymph nodes and the gut. Clinical features would be racking cough. A person would be coughing blood, chest pain, shortness of breath, fever, sweating, and unexplainable weight loss. The way to know if a person has tuberculosis is through microscopical examination of sputum for bacteria and chest x-ray. This is how the Mycobacterium tuberculosis look like underneath the scanning electron microscope. As you could see, it has a rod shape.
Well, there are two stages of infection. There's what's called a latent infection, which is when somebody gets infected with a very small amount of this bacteria, and the person's immune system is able to control it, and it sort of stays in hiding, so to speak. So that the person many times doesn't know they've been exposed, they don't know they have a little bit of this bacteria in their body, and usually they feel fine. The danger being that at some stage in the future, particularly if they get older or if their immune system gets weaker for any reason, it could reactivate. So that one usually doesn't feel as bad and isn't quite as serious and is not infectious to others. If somebody gets infected and then develops what we call an active infection, so the bacteria grows, it spreads, and actually causes the person to have symptoms, that can be very serious and the person will die if they're not identified and treated.
As we said in the first slide, tuberculosis is airborne, but there are certain factors that can lead to a higher risk of receiving or getting tuberculosis. First one will be living in overcrowded conditions, sleeping in a crowded place, if the person is homeless or in poor substandard housing, and they have low immunity, with malnutrition, and if they are HIV positive. It is said that if a person with TB coughs, this mycobacterium lingers in the surface or in the air for quite a long time. I have Mycobacterium bovi, and you can only get it if you eat undercooked beef or drink unpasteurized milk. This is how the infection occurs. So let's say a cow would be having a contact with another cow, and then this cow, let's say, was chosen and was not screened, and it was cut up or it is used for food by humans. The human can get the Mycobacterium bovi from that. And once this person is in contact with another person, this person can get the tuberculosis bacterium too. And if this human gets in contact with another cow, the cow can contract the Mycobacterium bovi. There was an almost eradication of tuberculosis, but there were some things that hindered this from happening, and those are strains that became resistant to drugs, meaning it mutated into something stronger and something that the antibiotics cannot handle anymore. Next will be HIV and AIDS pandemic. Number 3, poor housing in cities, because housing in cities is very small, cramped up, and then there are a lot of people inside the house. And then number 4, breakdown of TB programs, meaning the programs or the plans were not really denuded completely. So for diagnosis, you have chest x-ray, sputum smear, and culture examination. When you say sputum, sputum is a mixture of saliva and mucus coughed up from the respiratory tract, typically as a result of infection or other diseases. This one is examined microscopically in order to get diagnosis. Sputum collection occurs during the morning before breakfast, and it is induced or is spontaneously done by the patient. A person is asked to do deep breath and direct the sputum into the provided container by the medical personnel. After that, this one will be sent to the laboratory. A sputum smear is prepared and is examined underneath the microscope. Sputum culture can take 1 to 8 weeks to provide results. Rapid sputum tests can tell if a person has TB within 24 hours. And last but not the least, we have bronchoscopy. Bronchoscopy is a reliable method for diagnosis of tuberculosis with low complication rate. Bronchoscopy is a procedure that looks inside the lung airways. It involves inserting a bronchoscope tube with its light and small camera through your nose or mouth down your throat into your trachea or windpipe and to the bronchi and bronchioles of the lungs. Your doctor will usually discuss the bronchoscopy results with you 1 or 3 days after the procedure. Your doctor will use the results to decide how to treat any lung problems that were found or discuss procedures that were done. Tissue biopsy means that a tissue from your lung is taken in order to examine it more closely. Treatment. World Health Organization says that TB is treatable, but there are different courses that a person has to undergo to in order to ensure that they will be tuberculosis free. So we have the initial phase, which is the first 8 weeks of treatment. It uses 4 drugs that kills most of the bacterium found in the lungs. Next one, it is followed by the continuous phase, wherein a new set of drugs are given, which is usually 2. During continuous phase, 2 drugs are given to the person. And lastly, if and only if a person does not continue with the whole course of medicine, the person may have relapse. Relapse happens because there are some bacterium still left in the body of the patient. And during this phase, there might be drug resistance that is occurring in those bacteria present in the human body. Therefore, a patient must be provided with information, supervision, and support by a health worker or a trained volunteer.
So what we ended up building was basically a petri dish, except that it's 2 feet by 4 feet. And the way we set it up is that there are 9 bands, and at the base of each of these bands, we put a normal petri dish thick agar with different amounts of antibiotic. On the outside, there's no antibiotic. Just in from that, there's barely more than the E. coli can survive. Inside of that, there's 10 times as much, 100 times, and then finally the middle band has 1,000 times as much antibiotic. And then across the top of it, pour some thin agar that bacteria can move around in. The background is black because there's ink in it, and the bacteria appear as white. First, you see they spread in the area where there's no antibiotic, up until the point they can no longer survive. Then a mutant appears on the right. It's resistant to the antibiotic, it spreads, until it starts to compete with other mutants around it. When these mutants hit the next boundary, they too have to pause and develop new mutations to make it into 10 times as much antibiotic. And then you see the different mutants repeat this at 100. And after about 11 days, they finally make it into 1,000 times as much antibiotic as the wild type can survive. And so we can see by this process of accumulating successive mutations that bacteria, which are normally sensitive to an antibiotic, can evolve resistance to extremely high concentrations in a short period of time.
So that video shows you how does antibiotic resistance occur in bacterium. So Since a lot of people did not complete their course of tuberculosis medicine, there is now a very big number of drug-resistant mycobacterium around. If a person who has tuberculosis is not treated correctly or did not administer their medicine prescribed by the doctor, the mutation inside bacteria in their body can develop mutations. Stopping treatment means increased likelihood of developing drug-resistant forms and infecting others with resistant form of bacteria. In order to prevent this from happening, World Health Organization recommends to have direct observation treatment, which is a short course, in order to ensure completion of treatment. During direct observation treatment short course, a person is assigned a health worker or any responsible family member for 6 to 8 months to make sure that they really are taking their medicine. There are two types of resistant forms of tuberculosis. You have multiple drug-resistant TB and extensive or extremely drug-resistant TB. For multiple drug-resistant TB, also known as MDR-TB, they are only resistant to the antibiotics isoniazid and rifampicin. But if it is extensive or extremely drug-resistant, it is resistant to 5 of drugs that are used, and it does not respond to the standard 6-month treatment of tuberculosis. This one might have to occur for 2 or more years, therefore deeming it more expensive than the regular type of infection and the multiple drug-resistant infection. Prevention. Contact tracing and testing of the contacts would be beneficial because more often than not, the person who has tuberculosis might have, or there is a high probability that they have infected who they are surrounded with. BGC vaccine, which uses Bacillus calmette-guerin, is not really recommended for use in United States and UK because of the low risk of infection, but its effectivity decreases with age. So if a person is older, it might not be as potent if you use it compared to younger kids. But babies with HIV or AIDS should not be vaccinated at all. Next one, cattle testing to make sure that there will be no transfer from cattle or cows to humans. Lastly, milk pasteurization, which brings us back to this guy in the introduction video. Note, 6 countries account for 60% of the total of cases of tuberculosis, wherein India leads, followed by Indonesia, China, Nigeria, Pakistan, and South Africa.
Here's a question. Who invented pasteurized milk? If you said Louis Pasteur, you're only half right. Pasteur invented the process that carries his name, but he had no interest in milk. All he cared about was beer. In 1856, Lille, France is a beer town, and there's big trouble brewing. Beer keeps going bad, and no one knows why. Louis Pasteur is a chemistry professor in Lille, and he's studying fermentation, a hot topic at the time. Scientists aren't sure how sugar turns into alcohol, but Pasteur thinks there's life involved. The scientist takes samples of beer from local breweries and studies them under his microscope. He looks at fresh beer and spoiled beer again and again. For over a year, he looks for living creatures that hurt or help the alcohol. Finally, a breakthrough. Pasteur finds a key difference between good beer and bad. Good beer is full of round yeast cells, and spoiled beer is swimming with long microbes. Pasteur heats the bad beer and finds something amazing. Heating the beer for only a few minutes kills the bad microbes. This simple technique becomes known as pasteurization and is soon adopted for beer and wine. Pasteur thinks scientists should share their discoveries, not patent their ideas, but he changes his tune when he needs money for his laboratory. He applies for a U.S. patent on May 9, 1873, and uses the proceeds to fund his work. So where does the milk come in? Surprisingly, pasteurization doesn't hit the dairy industry for decades. Americans fear the new technology. They think it will destroy vitamins and make milk taste bad. So they want nothing to do with pasteurization. That all changes at the turn of the century. Scientists discover that cows can spread disease through their milk. Even worse, bad milk is linked with the deadliest disease of the day, tuberculosis. By 1907, scientists know that heating the milk can stop tuberculosis cold. Soon, Pasteur's process is the law of the land. Milk will never be the same. Americans drink more than 6 billion gallons of milk a year, and it hardly ever makes them sick. Less than 1% of disease outbreaks are caused by bad milk. And for that, we can thank Louis Pasteur and his pursuit of better beer.